Hello students, the next topic we're going to be learning is venous insufficiency. So in the previous session I had mentioned to you regarding the varicose veins, venous insufficiency, deep vein thrombosis and thrombophlebitis. So today we'll be learning in detail about what is venous insufficiency. So again, it really means the insufficiency of the veins to carry blood. Again, there are various reasons, so it is almost similar. So what happens here, the picture what is shown here, you can start to see that the legs are again very swollen, and you can see that the veins are very squiggly, and it is extending to a larger portion. So it is not just the varicose veins, and when that gets progressed, it ends up with a condition like this, which is called as chronic venous. Now what is insufficiency to define as? It is a condition that occurs when the venous walls or the valves in the leg veins are not working effectively. So in the previous picture I've showed you that how the valves are, and the valves also have got the the veins have also got the valves, which also allows the blood to flow in one direction only. And when that valves are not working effectively, then you end up with this particular condition, which is called as venous insufficiency, means where there is difficulty in the blood flowing to the heart from the legs. And chronic venous insufficiency, what it causes is it starts causing the blood to get pooled. Pooled means what? It's like, getting clogged up, okay, or getting collected in the veins, and this pooling is called as stasis, which is nothing but it is like just sitting there, pooling up, getting collected. It is not going anywhere, and that is how it results in this particular condition called as venous insufficiency. Eventually this as well. So the picture here is showing you the clinical manifestations of a chronic venous insufficiency. Means the disease has progressed to that an extent. You can see the person's leg, how swollen it is. You can really see the squiggly veins, okay, and there is also eczema, the ulcers present, induration, which again there is discoloration in the legs, and also there is severe swelling, okay. And what happens here is there is the veins have actually ruptured. So here what you see is all this is because of the incompetency of the veins or the venous valves that is not actually functioning properly. Okay, so that is why. So what you see here is one of the main veins being affected, and that can eventually progress to the entire venous system, and eventually causing the entire circulation towards the leg being affected. So the causes here are again due to damaged veins or the damaged valves of the veins, accumulation of blood in the damaged veins, and also eventually resulting formation of clot. Now the pathophysiology, what happens is due to all these risk factors, again there is going to be high pressure in the veins, okay, and this is going to cause a lot of inflammatory changes to the endothelial cells or the lining of the veins. And again what is going to cause, it is going to put a lot of pressure, and this is going to cause the valves to be affected and not to function effectively, or it is going to be functioning insufficiently, so resulting in this kind of changes that you see in the patient's legs, like the swelling and the stasis of the blood and the pooling of the blood, eventually leading to the skin changes or the discoloration, and finally leading to ulcer conditions. The risk factors associated with this particular conditions will include, as we already discussed or mentioned, age is one of the main factors. Heredity, so this can be actually being inherited from your from the parents to the children. Again, standing for a long time, obesity, any kind of injury or surgery in the past, and also the sedentary lifestyle. The symptoms will include severe pain, aching, cramping, burning of the skin, itching of the skin, severe swelling, inability to move around, feeling the heaviness in the legs, skin discolorations, skin rupture. There may be open wounds. It can be leading to very painful ulcers or sores. Again, the patient will be very restless. Again, this is nothing but the all the signs and symptoms that you will be seeing in patients having this kind of particular venous disease. How do we diagnose this particular condition? Yes, a physical examination, thorough history collection, and all the laboratory tests, doing an ultrasound, and also doing all the complete blood profile, and also the venography. As I told you, it can be performed in order to know the condition of the veins, and as measurements of the venous pressures, like doing a deeper study, and also the MRI imaging. So that is also can be done, so that we can have a deeper understanding about the veins and how it is functioning. The picture here is actually showing you the clinical manifestations experienced by the patient. So again, swelling in the lower limbs, aching, tenderness, leathery skin. That is what I mentioned to you. The skin can become very dark in color, and again, it means what? There is no proper circulation. It became very dark, brownish, and again it gives you a leathery effect, like a leather-like. Okay, and the skin can also start to flake, means itchiness can also be the flaking, means like the dry skin that occurs, and eventually leading to the stasis ulcers. Okay. The treatment will include, yes, to begin with, it's a conservative management, so you will be told to perform certain exercises, putting your legs up, wearing those compression stockings, and also there's also something called as the Una boot, which I'll show you later. And there are all the other surgical measures, as I mentioned to you, the surgical stripping, thermal ablation, which are the burning of the particular areas of the tissues, and it can also be done by laser therapies. Also the drug therapy, as we mentioned in the previous condition, like the sclerotherapy, can also be done in order to help the patient. The nursing care associated with this particular condition will be something similar to the previous condition what we studied, teaching the patient and the family members about how this is occurring, and even if it occurs, what are the treatment methods or the conservative ways of management, like your mobility, moving exercises, leg exercises, protecting from extreme weather conditions. It's also very important, because we told that the skin can becomes very dry and flaky, and becomes very itchy. So good skin care is very, very important. And also keep inspecting on the basis, do not do anything that will aggravate your skin, like pouring hot water or having a very hot shower, because again we know that it's very delicate. So the whole idea is to improve circulation, and this can only be achieved by following the proper instructions as to elevating the legs, wearing the compression stockings, medications, if it is administered, then follow them thoroughly. Diet is very, very important, cutting down sugar, salt, having a good fiber diet, and also making sure you follow up with the doctor's appointments. The nursing diagnosis will be ineffective health maintenance, again is nothing but due to lack of knowledge, ineffective tissue perfusion, anxiety, disturbed body image, risk for infection, impaired physical mobility, impaired skin integrity, and last but not the least will be the deficient knowledge. These are the nursing diagnoses. So based on your patient's conditions, complaints, this has to be prioritized, and the nurse has to be patient. Now, what are the preventive measures? So keeping a healthy weight, activity level, making sure that you perform good leg exercises, avoiding long periods of standing inactivity, and also making sure that taking breaks every 1 or 2 hours to walk around, not especially in a person who's having a sitting job. Make sure you take breaks and just move around, so that again that helps with the circulation. Especially when they have a family history of those varicose veins, it's very, very important to ensure that the person is being told about the importance of wearing these supportive stockings, and it's only to keep your weight effectively. And along with that, you will also have to follow a healthy diet, keeping your weight under control, obesity under check. If you have any other comorbidities like hypertension and blood diabetes, ensuring that those parameters and the levels are maintained effectively, and also following up with your doctors, keep up the appointments, and ensuring that the blood tests are being done, and also the doctors are being visited, and thorough investigations and the checks are being performed adequately and effectively, and yes, and also making sure that you follow the instructions that are being given to you by the doctors thoroughly. With that, we finish this small topic. Thank you for your time.